Nurse Choma, and I'm the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. And today I'm going to be talking with you about heart sounds on the NCLEX exam. Now, the reason why it's important for me to discuss this topic is because for the NCLEX exam, you do need to be familiar with very specific sounds that the NCLEX can test you on. One of the formats of questions on the NCLEX exam, whether it's the RN or the LPN exam, is audio format. So you may be presented with the opportunity or a question where you have to hear a sound and then identify what exactly does that sound mean. So let's go ahead and talk about what heart sounds are. So the first and foremost thing is that in order for you to really understand, how heart sounds work, you need to know the way that blood flow works. If you don't understand how blood normally flows through the heart and out to the rest of the body, it's going to be hard to retain this information. It's going to be very hard. So this is why I try to explain to people there are specific things that you want to know first to help set the right foundation so you can remember the information. So heart sounds, it's pretty much the reflection when you hear the valves closing in the heart. That's what it means. So what happens is that the valves in the heart, they close, and when they close, that is what creates a very specific sound. So the first thing is that when you listen to the heart, you hear the lub dub, right? You hear lub dub. So the lub represents the sound of S1, right? That's S1. And then dub is the sound called S2. So remember when for example, let's say you put a stethoscope on a patient's chest and you'll hear lub dub, lub dub, lub dub. So like I said, the lub is S1 and the dub is S2. So the lub sound or the S1 sound, this represents the closure of both the tricuspid valve and then also the mitral valve at the same time. Okay, so S2, this represents the closure of the aortic valve and then also the pulmonary valve as well. So here's actually a bonus tip. For the NCLEX exam, in addition to hearing the sound, it may actually show you a picture or a visualization, and then it will ask you to point out where that sound is. So it may be an X somewhere, and then you have to point out, okay, which valve is this? So that's important. That's why it's important for you to be able to not just know the sound, but be able to recognize, where on the chest is that valve, when you look at the heart. Okay? So anyways, like I said, S1 that's the closure of the mitral valve and that tricuspid valve. S2 is the closure of the pulmonic valve and the aortic valve. Then you have a third heart sound. So the third heart sound, this is not always heard. Okay, this is not always heard, but it can occur early in diastole. So diastole is when the heart is relaxing, right? When it's filling up, when it's relaxing again. So one of the types of people where it's normal to hear S3 would be young adults or athletes, right? So that would be one type of individual. Another type of individual, though, where you could hear an S3 sound, but it's not normal, is going to be patients who have congestive heart failure. Okay, patients who have congestive heart failure. So it's important that you recognize specific patients where you may hear a specific sound for the NCLEX exam, because it can describe a patient with a diagnosis, and then it may ask you, which sound, which type of sound would you likely hear, right? So then that's when you're going to be able to answer and say, an S3 sound. Okay, so this third heart sound that's occurring, so remember, the other sounds, they occur, the number 1 and number 2, the reason why we're hearing them is because a specific valves are closing. But with the third heart sound, what's happening here is being caused by a sudden drop or a deceleration of the blood flow into the left ventricle from the left atrium. One more time. So the reason why we hear a third heart sound where it's especially if it's abnormal in patients at CHF, is because there's a drop, there's a deceleration in the flow of blood into the left ventricle from the left atrium. Okay, so that's the third heart sound. Then you have the fourth heart sound. Okay, so the fourth heart sound, once again, these are what you call extra heart sounds. So S3 and S4 are extra heart sounds that is not normally heard on everybody. So the fourth heart sound occurs late in diastole. So you want to be aware of, early versus late. That does matter. Okay, that does matter. So with the fourth heart sound, this is going to occur late in diastole, and it's going to be usually heard just prior to the first heart sound. So one more time, the fourth heart sound is going to occur in late diastole, and it's going to be usually heard right before the first heart sound. Okay, and like I said, you have to be somebody where you're kind of trained in heart sounds, in the sense that you have to, for one, have a good stethoscope, and then two, if you are familiar with sounds. So what else? So likely on the test, when it comes to the extra sounds, it may not test you on your ability to hear the extra heart sounds, but it can test you on your awareness of the location or when it occurs, which is what I'm explaining to you right now. Okay, so the fourth heart sound, right, like I said, occurs in late diastole, just prior to the first heart sound. The first heart sound is normally going to be, so because of that reason, the first heart sound is going to normally decrease in intensity, and the second heart sound will also increase in intensity, right? So because of the extra sounds, the extra heart sounds, is causing the S1 to decrease and the S2 to increase. Okay, so I know this might be a little bit, so that's why you want to take your time, listen to this information so it kind of sinks in. And when you begin to listen to heart sounds, which I'm going to refer you to at a resource, it will help you to put it all together. All right, so the fourth heart sound is also produced by increase in stiffness of the left ventricle. And this could be because they have scar tissue formation, right? So one more time, the fourth heart sound, it can occur because the left ventricles are stiff. So because of that reason, that's why you're hearing that additional sound. And that occurred because they have some type of scar tissue. So here's the part where you have to think to yourself, here's a question: why would a patient have scar tissue formation on their heart? Right? Why would a patient have scar tissue formation on their heart? Well, a good example of this would be a patient who has coronary heart disease. Okay? Coronary heart disease. So patients with coronary heart disease are also at risk for having the extra heart sound of the fourth heart sound. Another reason why you would hear the fourth heart sound is because the left ventricle is thickened. It is enlarged. So this can be because they have hypertension. This can be because they have aortic stenosis. Those are some other reasons why you would cause the ventricle to be thickened, which in result would cause them to have extra heart sounds such as S4. So you want to be thinking to yourself, when you're thinking, you got to be thinking about the whole picture when it comes to patients. Try not to think very linear, where you just think of just one issue or just one problem, but you got to think of the whole picture about the patient. So because they're having the coronary heart disease, not only is it causing their blood pressure to be rise, but then also the ventricles are stiffened, and because the ventricles are stiffened, it can produce extra heart sounds such as S4. All right. Now, last but not least, as well, you want to be familiar with heart murmurs. All right. So heart murmurs, these are usually occur, I want to give you the specific definition, as a result from turbulent flow from blood that's not strong enough, all right, and it produces like an audible noise. So usually you're going to hear like a whooshing sound, all right? That's a heart murmur. It's like a whooshing, that's like a whooshing sound. So they'll have like mitral valve regurgitation, or they have aortic valve regurgitation. So pretty much what's happening is that the valves, they're not closing properly, and it's causing like a swishing sound, like a backflow of the blood. And so as a result, that's why you're hearing these murmurs. Okay, that's why we're hearing these murmurs as well. So you want to be so typically, the way that we'll diagnose this is going to be through a echocardiogram. All right, it's going to be diagnosed from an echocardiogram. Okay, now a resource that I recommend, all right, that I would recommend, because you don't want to just know the terms, you got to actually also be able to hear it too. So one resource that I would recommend is called easyauscultation.com. Write that down. easyauscultation.com. This is a great resource where you can literally, they even have where you can download for free some samples of heart sounds, like the ones I just mentioned right now. And you can go ahead and download them, and you can listen to them for free, or on their website, and you can listen to them, and that will help you to, just get a little bit more comfortable with heart sounds. So just put your attention mainly to like the S1 and S2 and the location, okay? Like as far as like seeing it on like a picture, about the valves and everything. All right? So that's one resource that I would recommend. So this is what you need to know about heart sounds on the NCLEX exam.